Welcome to the launch of HealthGap AC. My name is Leon Bascom, and I am the President and CEO of Moongate Insurance. And firstly, I'd like to thank God for giving us this vision and opportunity to truly give back to our community and help numerous individuals. People ask, how did this program start? Well, Moongate, as an agent of the Health Insurance Department of the Government of Bermuda, has a very close relationship with the director, Colin Anderson. And when we were meeting with him, we were identifying some places where there may be some void in some of the policies. And we initially started in terms of looking at the air ambulance. As many people know, the air ambulance services could be very expensive. And so in our discussion with him, what we initially done was we teamed up with our friends from Massa, and I will introduce them shortly, and we helped to fill some of those gaps. And so what we did was focus on the additional gaps in cover that are specific to the hip and future care. Some people may ask, why is this important? There are certainly many policies, not just hip and future care, that don't cover everything. And what happens is that certain individuals are left with what we call a copay. So whatever the government or whatever your policy covers, if it covers 60 or 70 or 80%, a person is left with a copay of, say, 20%. And so what the HealthGap does is address some of these concerns with regard to the copay. The HealthGap product basically is a collation between international and local service providers offering special services and discounts to members of the HealthGap AC program. So we're very excited to be a part of Age Concern and rolling out this product called HealthGap AC. Again, this is to exclusive members of Age Concern or potential members of Age Concern, and I'll have Claudette come up in a while, and she will talk a little bit more of the details. Specifically with regard to the HealthGap AC, we have vendors in there who are providing discounts which range from 10 to 15%. The cost of this is $70 a month. $70 a month for those people who are members of Age Concern or want to be members of Age Concern. So this is a special price. Again, this is a collation of products and services that are designed to supplement any type of health insurance policy. I want to say and re-emphasize that our mandate at Moongate Insurance is really for us to be here to help. We want to help our seniors. We want to certainly help the Bermuda community at large. We want to provide information. We certainly want to ensure that people do read their policies. We want to make sure that people are informed. And we would certainly do the best that we can to assist in bringing down even some of the costs in terms of Bermuda's healthcare environment.
The Ministry of Health and Environment recognizes the difficult economic times that Bermuda faces and the difficult fiscal situation that the government faces. We are acutely aware of the high cost of health care in Bermuda, the present inequalities in healthcare spending, and the complex, fragmented healthcare system that currently exists. We can also appreciate how this cumulative set of circumstances can make obtaining the right care in the right place at the right time and at the right price difficult for certain segments of the population and for seniors in particular. We are glad to see such a unified, collaborative approach that provides additional non-insurance benefits to our seniors. At the heart of the ministry's strategic priorities is the long-term aim of making the healthcare system more affordable and accessible for all, while improving its sustainability. In short, we want healthy people in healthy communities, and we are optimistic that today's announcement is a big step in that direction. Thank you very much.
It is my pleasure to be a part of this historic occasion of the introduction of HealthGap AC, offered by Moongate Insurance for the benefit of the Age Concern membership. These are indeed interesting times in Bermuda, times when pockets are lean and budgets are mean, times when healthcare costs have become the central focus of conversation and concern, and rightly so. In 2013, the Bermuda Health Council released a very helpful healthcare expenditure brochure on statistics concerning the current state of healthcare costs in Bermuda. The flyer identified some very interesting economic trends. For example, health spending in Bermuda is growing faster than GDP. The cost of hospitalization claims is increasing in Bermuda. The insured population of Bermuda is decreasing. Health spending per person continues to grow each year. News of the spiraling cost of healthcare may not be enough to get the attention of the younger Bermudian. However, senior citizens have identified that they are well aware of the cost of healthcare and its impact on their financial well-being. In June of 2013, Age Concern conducted a survey of its membership. Over 600 members responded. More than 60% of respondents indicated that healthcare costs were their primary concern. It is no wonder then that the Minister of Community and Cultural Affairs, who is responsible for the island's financial assistance program, recently quoted that seniors account for 2/3 of financial assistance recipients historically. For some, payment of healthcare insurance coverage is an important part of the financial assistance that they receive. So worrying is the current healthcare situation to public policymakers that in his recent budget speech, Minister of Finance, the Honorable Bob Richards, referred to Bermuda's healthcare system as a runaway fast car. Well, that's the bad news. Today, the good news is that if Bermuda's healthcare system is the proverbial runaway fast car, then Health Gap AC is the proverbial Volkswagen. In preparation for this speech today, I looked up the controversial history of the Volkswagen, which is the final result of the 1930s People's Project in Germany, a series of hybrid car design programs aimed to achieve a classy yet affordable automobile for the average person, as the average German could only afford a pedal cycle at that time. While the People's Project and the Volkswagen have a tumultuous socialist past, few can argue that the well-known Volkswagen Beetle grew to be loved by many private car owners worldwide. Age Concern is pleased to be a part of the launch of Bermuda's healthcare coverage Volkswagen Beetle, Health Gap AC. Health Gap AC represents an affordable healthcare insurance package that exists to top up existing healthcare coverage. The insurance package has been designed specifically for members of Age Concern, persons 50 years and older, the people that we serve. We look forward to the success and expansion of this affordable insurance package and are grateful to the Moongate Insurance team for delivering this vitally important product to the current healthcare insurance market of Bermuda.